Welcome, everyone. Welcome to another one of our monthly free wellness webinars. This month's topic is kidney health and chronic kidney disease. Usually Kidney Health Awareness Month is in March. We are currently in April. April is usually Gut Health Awareness Month, but we did gut health last year, so I wanted to mix things up a little bit and give you kidney health instead. Still a very prominent condition and also very related to other prominent conditions as well. So let's get kick-starting here with the objectives of what I hope everybody takes away when we are done, which is understanding a little bit more about the role and functions of our kidneys, the different stages we're going to take you through as well if you happen to know someone or are at risk for or are diagnosed with chronic kidney disease, and then some general but also some specific guidelines regarding supporting your health overall and supporting your stages of chronic kidney disease. Housekeeping stuff, as you probably heard as you entered into our webinar, we are recording this session. This is going to be for anybody who was not able to attend live. You'll receive a link after the fact. And in a couple of months, I also put the recording up in my public facing Dish with Dina TV YouTube channel. So feel free if you want to open your mic or open your camera when we do the Q&A later, that's okay, but just know that you're going to be recorded and eventually on my YouTube channel. You can keep your questions until the end of the presentation if you like, or you can do the Q&A, or I'm sorry, you can use the chat feature, which I'll keep my eye on as we advance through the slides. As always, I like to say I am a dietitian, not your dietitian, so please make sure that if you are doing anything, adjusting any health and wellness habits or medications, that you're checking with your own independent personal professionals, your healthcare providers, before you make any adjustments. And be sure to get, clearance before you do any of those things too. As a follow-up with our webinar, so for anybody who registers, you're automatically put into our email distribution list. So you'll get, like I said, a copy or a link to this recording after the fact. You'll also get a survey link too. It is so important. I know you don't have time to do this, I know, but please, if you can, just take 5 to 10 minutes to fill out our survey after the event is over. Probably in another day or so, you'll receive that email as a thank you, because it really does help us keep an eye out for other topics that you are interested in, and also how we can maybe improve what we're doing in these things too. You'll also be receiving the newsletter. So as Dish with Dina, I put those things out once a month. I try not to kill anybody's inboxes, so I don't inundate you too much, but you can always opt out if you don't want to hear from me anymore. That's totally fine. I won't take it personally. All right, if we've never met before, hello, my name is Dina D'Alessandro. I am a registered dietitian nutritionist here in both, well, here currently right now I'm in New Jersey, but technically I'm also in New York City, where I own and operate a virtual platform called Dish with Dina, and I do a bunch of other things, as you can see here on the slide. I'm not even going to talk about it because the most important thing I do is mentoring and precepting my nutrition students, student volunteers, and dietetic interns who are going to go off into the future to become my dietitian colleagues. And so today I'm so excited because it's been so long since I've had a co-facilitator. I'm going to hand this off to my dietetic intern, Nahama, who I'm working with right now, and who's going to be co-facilitating this with me today.
Hello, everyone, and thank you, Dina. Thanks for having me. My name is Nahama, and I am a dietetic intern with Keith and Associates Distance Dietetic Internship. I'm also a master's student at Lamar University, where I'm studying applied nutrition. My past experience includes mental health clinic administration. I've worked at the clinic for the past 5 years, recently on a project called QIC, which is Quality Improvement Collaborative, and it is a New York State program that works with mental health clinics to implement programs that focus on improving client outcomes. I am also passionate about helping people manage their GI-related symptoms through nutrition intervention.
Thank you. So I always like to start off a little bit about what the system is. In case you don't know, your kidneys are part of your urinary system, and we'll talk a little bit too about the role and functions of them. So the anatomy view, if you remember, gosh, like I said, probably last year when we did the gut health one, the gut system is very complex and complicated. And in the kidneys, still very complex and complicated, but kind of a tinier little version as to where they are located within your body. So the kidneys that you see there are about the size of your fist. And then we have the ureters that run down to the bladder, and they excrete the waste through urine through the urethra. Now, if you have a male body, you also have a prostate. And the reason why I bring this up is because if you do have issues with your prostate, and a large prostate can obstruct the urine flow, and because of that can cause things like kidney infection or kidney damage moving forward. So it's always important to make sure you're keeping track track of that. Functions of our kidneys, my friends, please, I say this time and time again, don't give in to the hype of your infomercials and the marketing ploys about buying detoxes and cleanses. If you have good functioning kidneys, they are doing the work for you. So as long as you're maintaining your health and doing what you can to support your kidney health specifically. Or if you don't have good functioning kidneys, we're going to give you other options of what to do to treat them. But I always say save your money with these detoxes and cleanses. The stuff that you see in front of you here are the main functions of the kidneys, but we're probably going to focus mostly today on the blood pressure and the pharmaceuticals as well, because those are a little bit more important in what we're talking about in today's conversation. I'm going to hand this back over for a pop quiz now to Nahama.
All right, so if you have the answer to this question, you can just put it in the chat box. But the question is, each kidney is made up of about 1 million blank, the basic functional unit of the kidneys. Is it A, B, C, or D? And if you have the answer, you can just put that in the chat box.
I know I see some students on here, so show off your anatomy knowledge. Throw in the chat there, A, B, C, or D. Give it a
Oh, we've
sec.
got
I
we've
see,
already seen the correct
I see
answer.
one so far.
You got it. It's A, nephrons.
It is a nephron. So again, another little anatomy view here because the powerhouse of the kidney, if you, like I said before, if you kind of make a fist with your hands, that's the size of your kidney. And you can just imagine a million of these nephrons in there doing what they're supposed to do, which is just, I mean, the human body is fascinating to me to begin with. So I just absolutely love this. And so the way that this works is it's a two-step process where you see what is known as the glomerulus and the tubules, and those are filtering your blood and then returning any necessary substances back clean back to the blood system and then removing the waste out through the urinary duct or in the urine. Another pop quiz coming soon. Nahama, I'm going to hand this over to you as far as the stages of chronic kidney disease.
All right, here we go. There are a blank number of stages of chronic kidney disease. Is there 2, 3, 4, or 5? And you can put your answer in the chat box.
We'll give everybody a sec. Play my little Jeopardy music in my head. And any guesses?
All right, you got it. There are 5 number of stages.
5 stages of chronic kidney disease, or we sometimes call this CKD. So in case you hear us using that acronym in the course of the presentation, we'll know what we're talking about. So here at a glance is this image as to what that means. Chronic kidney disease takes place in 5 stages. Stage 3 is broken up into 2 stages there. You think of it as like your kidneys are like a balloon or container of some sort. Normal functioning kidneys are at 100%, and then as they decrease in functionality, they go down to, as you can see, right, 80, 50, 60, whatever, 40, 30, et cetera, down to less than 15%. That is also correlated to something called the GFR, which we'll talk about in a second. So that number is also going down, decreasing, but as those functions go down, your stage numbers go up to what we have known as CKD stage 5, also known as kidney failure, also known as end stage renal disease. So I like sharing these things because sometimes people don't know the different language that is used, and I want to make sure that it's simplified.
All right, let's go into the risk factors. And I'm sorry if there's background noise, of course, it has to go on right now. So the risk factors for CKD are actually interesting because there are two-way risks where some of these risks can cause CKD, and CKD can actually cause some of these risks as well. So we've got type 1 and type 2 diabetes, hypertension, cardiovascular disease, and family history of kidney failure. Question. A person can have chronic kidney disease without any symptoms. Would you say that would be true or false? You can put that in the chat box.
And we'll give everybody a sec to chime in. I see. Thank you, Genesis. I got a bunch of smarty pants here. Thank you so much, everybody, for chiming in.
All right, there goes our answer.
Yeah, true. So this is what kind of is the challenging thing about chronic kidney disease. And a lot of times we don't even see chronic kidney disease being diagnosed until about stage 3, which can feel very overwhelming or challenging for people who are not aware of what might be taking place. So obviously, if you're dealing with blood pressure or diabetes issues, that in itself might lead you to have more screenings with your doctor. So they're probably going to be keeping an eye more out on your kidneys. And at a glance, I don't want to be stressing out saying, oh, I have sleep problems and I feel fatigued. therefore I must have kidney disease. It's one of those things that I tend to tell people, just keep track of patterns. One of the main things that you can take a look at, because it's related to urine and also proteins, which we'll talk about in a second, is if your body is unable to process properly the proteins in your diet, you're going to end up seeing that build up and it turns into what is called like foamy or bubbly urine in the toilet. So when you go to urinate, that's a key thing to keep an eye out for and just make mention to your doctor if that's an issue. And then as you go down further, urinating more or less, that's an issue too. Obviously, again, the urinary system is being affected. So if it's not being properly managed, or as you're progressing through the stages, you might end up seeing some changes in your urine tract, urine patterns, I should say. And that's something to bring up to your doctor as well. And then some of the more kind of like prominent ones, if it is progressing into certain stages and you're not aware of it and it's progressing quickly, you might notice things like the breath smelling like ammonia, which is a byproduct of urine metabolism as well. So I'm jumping into here to teach also about the diagnoses of things. So I mentioned before that GFR, but we also look in the urine in case we look at urine albumin, and these are things that sometimes you'll see on the printouts of your blood test, and you might be a little bit confused about things, especially when they just use acronyms. They don't necessarily explain things to you, but that is a key indication as to how to keep track, like the percentage of the function of what is going on with your kidneys, of being aware of that. I have a little asterisk here that I just wanted to point out regarding something that does happen sometimes in health and science, in that sometimes we distinguish or separate out certain races or ethnic groups. And a while back, there was a separation out for African Americans or people who identify as Black. And what we've come to learn that early detection and appropriate treatment of any of these complications here are obviously going to improve. But what happens in the Black community is sometimes they were either overdiagnosed or misdiagnosed merely because we thought there was a correlation between kidney disease and race. So I'm happy to report that as of 2021, the powers that be removed race from the equation. But I still bring this up because a lot of medical facilities either are still using old systems or old printouts, or sometimes, let's be honest, sometimes doctors and healthcare providers don't really keep up on the current research or updates like that. So if you are of African American descent, if you identify as Black, just make sure that you notice if you're reading your lab values, you might see EGFR as one line, and then you might see underneath it EGFR AFAM, AFAM, to indicate African American, in which case just mention to your doctor, can you please double check this and make sure it is correct, because that has been removed as an indicator. Next up, we'll share with you some treatments to help slow progression and manage symptoms and overall quality of life. So as we said, blood pressure is a key issue with people with kidney disease. So you're probably going to be put on hypertensives, which are to lower your blood pressure. Lifestyle changes, we'll go a little bit more into detail about some specific limitations that you might have to take into consideration when you're creating meal plans for yourself. If you end up in stage 5, you have 2 options that are listed here. You have dialysis, which I'll talk about a little bit more in detail shortly, and you also have kidney transplant. So kidney transplant is exactly that. You're getting somebody else's kidney, and fun fact about the human body, you can live with just one kidney. So if you match with somebody that you know and love and they want to donate their kidney to you, that could be an option, but you will be on anti-rejection medicine for the rest of your life, because obviously your body thinks that there's a foreign object in it and you want to make sure it's not rejecting the organ. Underneath that, we have specific medications that help with slowing down the progression of kidney disease. And the thing that I don't think I mentioned earlier when it comes to pharmaceuticals is that they are metabolized in your body either through the kidney system or through the liver. So since if you are currently diagnosed with or you're at risk for kidney disease and you're trying to manage that, a lot of the pharmaceuticals that you are taking, you might be able to get the ones that metabolize instead through the liver. So I know sometimes we take like, over the counter things like Tylenol or Aleve, even things like that, you might have to just discuss with your doctor or your pharmacist to make sure they're not putting more stress on your liver. So something like Farxiga, that is a kidney disease specific medication that metabolizes through the liver. Allopurinol, that's something that helps with reducing the protein sources that lead to a buildup of uric acid. So anybody who has gout probably has, this is a very, very painful condition to have that kind of flares up unknowingly. So allopurinol helps remove that amino acid, that protein source from your body, and helps with reducing the frequency or the severity of gout. And that is also metabolized through your liver. So again, each one of these systems are going to be put into some sort of stress if you are on short-term or long-term medications, just making sure you are aware of what's going on there. And then the follow-up session. So every 3 months, you're probably going to be brought back in for more blood and urine tests because that's how quickly things regenerate in our body, especially with when we talk about blood cells and making sure that we're keeping on top of any progression from one stage to the next. All right, I'm going to turn this over to Nahama to explain a little bit more about blood pressure stages.
Okay, so what you see here is the chart with the different categories of blood pressure. So we go from normal, which is less than 120 and less than 80, all the way down to hypertensive crisis, which would be a blood pressure of higher than 180 and higher than 120 of diastolic.
Right. So this chart was updated in November of 2017. So back in the day, we used to say normal blood pressure was 120 over 80. But as Muhammad just mentioned, and you can see on screen here, it's adjusted a little bit. On the bottom, there's a note that if you are currently diagnosed with diabetes and or chronic kidney disease of any stage, your doctor might adjust the quote unquote recommended normal stage of what you will be seeing. So if you are tasked with taking blood pressure measurements at home, or if you are in a clinic and you get a readout and somebody says, oh, that's quite high, you can tell them, no, my doctor had recommended that as long as I'm staying maybe under 140 over under 90, that's my normal now. Ideally 130 over 70 would be ideal. And as you can see, if you compare that kind of to the image on screen, that would put anyone else in a stage 1 hypertensive category. But for people who are dealing with diabetes and or chronic kidney disease, that number is going to be adjusted. So I always like to share things like this just that you can be an educated patient, but also if you are watching this as a healthcare provider, just remembering things like that exist. If we remember a couple of months ago when we did the science of weight, and we talked about the shifting categories of different percentiles and things, it's kind of similar to that. We're kind of skewing things to make sure that we're given the proper and accurate information to our patients as well. All right, I'm going to talk a little bit here about dialysis. So if you have reached stage 5, chronic kidney disease stage 5, there's a couple of options within dialysis. Dialysis is the machine that does the function of your kidneys when it comes to filtering out your blood and helping you get clean blood back into your system. If you do HD, if you do hemodialysis, you're going to a kidney center where they put a little port in your access point in the arm, and you're going there. It's very time consuming and it can be quite fatiguing as well. I mean, obviously, right? You're getting your blood circulated out and back into your body. So you're going there about 3 to 5 times a week, and maybe you're going there for about 2 to 3 hours per session. And this is why dialysis centers, thank goodness, are usually open quite early in the morning, about 6 a.m., to accommodate people who might have to, yes, go do their job, right? Go back to work. Some people find this totally fine and they get very used to it. I used to work as a personal chef for someone who was on hemodialysis, and she was in her 80s and she was just exhausted, which is why I would go to her house and I would help prepare her foods and I would help, whatever like little light things that she needed to do around her home because it can be kind of draining. Peritoneal dialysis, PD, that's something you can take home with you. It's a machine that you bring home. The port instead is in the abdomen. So that is what's known as the peritoneum. And that you would be doing daily. So you set it up, you plug the little thing in, and you kind of do the cycle. I'm not entirely sure if you can walk around with it. You might have to be seated, but it's a little bit easier on a person who might not be able to get transported to a dialysis center. But the possible complications here is infection because you're doing this at home. So you have to make sure you're keeping things clean, you're keeping the machine clean, and you're following the instructions appropriately. All right. I know a lot of you here know that I talk about my mom. So I'm just going to walk you through her situation. And she always gives me her permission to share her conditions. She's a hot mess from top to bottom, for sure. But the thing that we are most concerned about right now is she has chronic kidney disease, stage 5. So my mom is at end stage renal disease. A lot of times when people get diagnosed, they get very worried. Like, how long is this going to last? What do I need to do to slow it down? What are my outcomes? And truth be told, we don't know. We don't know. It's not like I could go to the doctor or nephrologist. We could go, by the way, that's why you go to a nephrologist, right? Nephrologist. When we went to talk to him, it's not like he can say, oh, you have 6 months to live, or, in 3 weeks, this is going to progress from one stage to the next. So I just want to share kind of like an at a glance of my mom's situation where she was one of the people who didn't get diagnosed until stage 3. She was one of the people who had very high blood pressure back in the day and was put on long-term meds without okay, listen to where I'm going with this, without any consultation with a dietitian and with any informed consent about taking those medicines. So because of that particular condition and because of those long-term medications, they did stress out her kidneys and she ended up getting diagnosed with stage 3 chronic kidney disease back in like 2016 or 2017. To this day, she has never been refer to a dietitian. I just want to make that known. So I am a dietitian and I help her out, but it's a curious thing that I really want to advocate for. And I encourage everyone out there, if you're dealing with something similar, whether you are the patient or the care provider, just be aware that we can help and we can step in. All right, I digress. Anyway, so in 2019, she had a fall. She fell and broke her femur, which is the longest and strongest bone in the body. It is in your leg, kind of like from hip to knee area there. Word on the street is you only break this thing if you're in a car accident. My mom tripped over a rug in Atlantic City Casino, and that's how she did it. She's tiny, so it didn't take too far for her to fall. So maybe the impact was a little harder. But that put her in a hospital, and she ended up having to get an operation, surgery, put pins in her femur, and recover from that. And she was put on meds to stabilize all the enzymes, and she actually had a hypotensive situation. She almost passed out during her recovery of that too. So she was in the hospital for about a week. And so from there, she ended up, right? So wherever she was at stage 3, she was at stage 3A, and she ended up at stage 3B. And if you can see the GFR correlation, she's at 35 GFR. Flash forward a year later, sort of almost to the day, she falls down in her home and she hits her head wide open and she's rushed to the hospital, and it ends up being a superficial issue, not a big deal. But while she's there, they notice that she has a heart murmur, which she's had for her whole life, but it has gotten progressively worse. And they start doing some tests and they notice that she needs a trans-aortic valve replacement. She needs a heart valve replacement. Kids, this was literally March 24th or 26th of 2020. I wonder what else was happening in March 20 of 2020. Yeah, so she was in the hospital for an entire week under COVID restrictions, and all I could do was sit out in the parking lot and just cry because I didn't know what was going on with her. But while she was in there, she was also told that there were surgeries being put on hiatus. So because her TAVR, even if it was, very important, the heart is a very important organ, she couldn't, it was considered elective. So she was put on hiatus until July. So she's in the hospital for falling and hitting her head. She's on a bunch of meds to stabilize. Her high blood pressure is all over the place because now she has to get surgery in her heart and she's nervous about that too. There she, right within a year now, so she went from stage 3B to stage 4. Her GFR dropped from 35 to 25. Then in 21, you can see just the natural progression because now she's in stage 4. Now it's a little bit more sensitive of an issue. Her kidneys are not functioning as strongly as they were in the past few years. And you can see kind of the progression there. But over the course of 5 years, it's going up and down a little bit, 10 points down, then 8 points down. And then weirdly enough, in 2022, it went back up a couple of points, which is kind of unheard of. And then 2023, 4, and 5, as you can see here. So I'm also going to share with you too something that sometimes feels a little sad, but it's okay because my mom, she's going to get mad at me if I tell you how old she is, but she's going to be turning 90 this month. And she has made a decision at stage 5 that she's denying any treatment for it. So she's not interested in dialysis because she's an independent gal on the go. As much as the things that she's dealing with and things that she's managing, and as far as her conditions are concerned, she loves being active and she doesn't want to be sitting in a dialysis center feeling depleted and feeling really sorry for herself. She's also not necessarily a candidate right now for kidney transplant, but even if she were, I wouldn't necessarily recommend somebody who's 90 to go under that sort of invasive treatment approach. So she's just riding it out. And I share this also because a lot of you are either healthcare providers, patients yourselves, or caregivers. And as a caregiver, this is something that I felt really concerned about, was keeping me up at night. Like, oh my gosh, when's she going to progress? Is she okay? What's going on? And so as long as everything's in writing, as long as I feel really that we can honor and respect her wishes, I feel like it's taken a big stress off of me. The only issue here is that as she progresses less and less, because you can see she's now at GFR 12, which is quite low, that she might start feeling complications, getting dizzy, confused. You saw all those symptoms I mentioned earlier. And so because of that, we've made sure we have community people that check in on her. I come down and check in on her. We have people that we can call if we need to have anybody come. And, if the case may be that we need a home health person to come in and help her out, we can do that. But we have everything in writing. We feel really comfortable and safe with those decisions that we've made. All right. So thank you for letting me share that with all of you. And on that note, I'm going to turn it over back to Nahama, who's going to talk to you about dietary guidelines.
All right, so let's go through the kidney health support and disease management. So here we've got another question that you can answer in the chat box if you feel like you want to. There are people with CKD stages 3 to 5 may have to limit which of the following foods or nutrients. Would that be A, sodium foods, high sodium foods, B, high potassium foods, C, high phosphorus foods, or D, high protein foods? And you can put your answer in the chat box.
All right, we'll give it a sec if anybody wants to chime in.
And there we've got it. It is actually all of the above. Uh, some people may have to limit fluids and protein, but that's important to note, but that would be generally discussed with the doctor for each person. All right, so that leads us into what is known as the salty six, which a lot of Americans are consuming a lot of these foods, and that is contributing to the high amount of sodium that they are consuming. Some people may think that if they limit the amount of salt that they add to their home cooked foods, that may be helpful, but what we've seen is that some of these salty six foods are the ones that are contributing to the high sodium consumption. So what we see on the screen is sandwiches, pizza, bread and rolls, cold cuts and cured meats, canned soups, and burritos and tacos. That leads us up to the next one, which is high potassium foods. On the screen, there are a bunch of foods that have a lot of potassium in it. You may notice that some of these foods are actually very healthy. They're considered healthier foods. They're not necessarily processed, and they do have high potassium. So if somebody is watching their potassium intake, then they may want to limit some of this consumption or maybe not have it at all. So on the screen, we have on the left side a glass of orange juice, and on the right side, a glass of cranberry juice. If you'd like to answer in the chat box, which one do you think has more potassium?
OJ or CJ?
And here goes our answer. So actually, orange juice has more potassium, and in a glass of orange juice, there is about 496 milligrams, whereas in a glass of cranberry juice, there is only 195. All right, so high phosphorus foods. Again, some of these foods on the screen actually are considered pretty nutritious and may have a lot of other essential nutrients. But if somebody were monitoring their amount of phosphorus that they're consuming, they may want to limit or actually not have some of these foods on the screen. And again, a question. Which one do you think has more phosphorus? Would you say some pork or some kidney beans? Which one do you think has more phosphorus in a serving? If you want to answer in the chat box, you may.
Give it a sec.
All right, here goes our answer. So in one serving of pork, it actually has more phosphorus than in a serving of beans. So there's about 230 milligrams in some pork, whereas in a serving of kidney beans, it would be about 125 milligrams.
Thank you, Nahama. The thing I want to point out about this too, as you were seeing, right, it's like you look at all the really good, delicious foods and you think, oh, I can't have any of that. But there is a bit of a hierarchy. So if you notice in the potassium thing, I would usually say something like banana, avocados, potatoes, oranges are probably higher. So it's not like we're saying to take things completely out of your diet, but especially if you're working with a dietitian or using some of the resources I'm going to share in a second about creating meal plans, you have a limit for the day. Same thing with sodium, right? You have a limit for the day. So it's not like you can't have any pizza ever, but it's about the variety and the balance and the proportions of what you're doing. So even if you have something like pork or you have something like orange juice, maybe you have the orange juice, but you dilute half of it. Or maybe you break it up over the course of a couple of days. So maybe one day you have the pork and one day you have the beans, and then you go back to some eggs. And again, kind of like mixing and matching some of those foods. So you still get the good quality nutrients out of those meals, but you're not putting yourself above and beyond whatever might be determined as far as limitations are concerned for you. And just to clarify too, all of those things that you saw on that slide with, what should be limited, sometimes they're not all limited at the same time. This is again looking at the lab results with your doctor. Depending on your potassium levels, they might be okay. So some things might be fully restricted and some things might be limited. So again, working with your doctor and your dietitian will also be very helpful. I want to take a moment to give props to some of these federal health agencies that help us with creating and identifying and understanding how the research is done for all of this so that we as healthcare providers can help those people we work with and the patients and clients that we work with. And also things like this too, right? This is where I get a lot of my resources from and look at the research, and I work with my students as well, where we can determine what is serving us when we're writing papers and presentations. And so I just want to share this because, as I'm sure a lot of us are aware right now, there are some, federal agency issues going on, some potential stability concerns to be aware of. So the NIDDK, which is the National Institute of Diabetes, Digestive and Kidney Diseases, falls under the National Institutes of Health, which falls under the Department of Health and Human Services. So these agencies, they're very critical. They do a lot of funding for research supporting clinical trials. They help with developing evidence-based guidelines, which is a very big deal. We're in science-based world here. We like to look at the research before we give any guidance. And so any disruption in those operations can delay or limit the access that we have to updated, up to date, reliable healthcare information. So just a reminder, just like how vital things are, stay informed, advocate for things that you think are important so that we can support you if you are the patient, and so that you as the patient feels, safe that you're getting the proper treatment. And here I'll share with you a couple of things that are a little bit more user directed. So if you are somebody who is currently managing or at risk for or is taking care of somebody with chronic kidney disease, that you have the National Kidney Foundation on the left-hand side there. They actually rely on private and public funding donations from individuals, foundations, and corporations. So I don't think that they would be affected if anything happens in the administration within the next couple of years. I think that would still be kind of safe and stable. So they offer a lot of resources, treatment centers, support groups, put you in touch with other people or organizations or programs. And then DaVita is a dialysis center across the country. A lot of the dietetic interns with whom I work and a lot of my colleagues are renal dietitians, and they do their rotations or they have their services in the DaVita healthcare, or I should say the dialysis centers across the country. And DaVita dialysis centers they are federally funded primarily through Medicare and government-based health insurance programs, and also some private insurance programs and plans. So that could be affected depending on any changes in eligibility criteria or funding, et cetera. So just things to keep in mind. I love DaVita. I've actually used this for some of you who are on here as my students. I've actually used this in some of my case studies when we do assignments in class where we have to look and see what meal plans and recipes we can give somebody with chronic kidney disease. And DaVita has a wonderful, wonderful drop-down menu that you can actually select by stage, or it has a recipe book that tells you which stage of chronic kidney disease these recipes would be most appropriate for. So it takes the guesswork out, because it can be quite stressful to manage anything in your life, let alone something that you feel is going to progress if you don't take proper care of it. I'm going to hand this back over to Nahama.
So let's talk about an action plan that we can do for somebody who is in the various stages of CKD to prevent or slow the progression of kidney disease. So firstly, we want to manage underlying conditions, whether that be diabetes or high blood pressure. We want to make sure that those are under control. So that might be discussing with a doctor or a dietitian about those other conditions. We also want to adopt a healthy lifestyle. So that may be to add in a bunch of fresh fruits and vegetables, or limit processed foods, saturated fat, excess sodium, added sugars, any of those that might be something that's in your diet. We also want to make sure to engage in regular exercise or mindful movement, which is very important for many people with many different backgrounds. We also want to make sure that we are staying hydrated. So if that is a concern for somebody with CKD who is only able to have limited hydration, we do want to make sure that they are not actually underhydrated. Again, we want to make sure to follow medical advice. So whatever your doctor tells you about any of these things, let's just make sure to have that in mind as well. We also want to be mindful of medications. So you want to have regular checkups with your doctor and make sure that you are screened for risk of any of these other issues that might be coming up. And you could also ask your pharmacist if any of the medications that you're currently taking might interfere with your CKD and symptoms. Okay, so let's go through a few simple, quick meals um, that contain potassium and phosphorus and protein, but in limited amounts. So we'll go through some of these and we'll explain the recipe names. And the first one will be quinoa and vegetable stir fry. The next one will be Mediterranean chickpea salad. And we've also got baked salmon with lemon and herbs. We've also got infused waters. So these actually are water that have some extra flavor in it if you have a hard time drinking because you just don't like the flavor of water, but having some of those flavored drinks that are full of sugar or full of other things might not be your option. So if you want to add some flavored like fruits or maybe some cucumber, some lemon, just to give it a little bit more excitement, that might be helpful for you. And then lastly, we've got a berry smoothie, which is a bunch of blended berries. That is probably delicious. So that might be an option for somebody who is ready for an exciting meal.
Thank you, Nahama. Yeah, these are all just like, examples of things. I think the thing that I think of when I work with somebody or I hear somebody who's being diagnosed with something new, they either are misinformed, right? Their doctor might scare the heck out of them that they can't eat anything, or they hand them a list of foods like you saw before in those slides of like, these are high potassium foods and these are high phosphorus foods. Okay, well, what's left for me to eat? But we're giving you some examples of things that could be considered safe and still really nutrient dense. And if you're adding things in, again, if you're working with a dietitian or you have access to resources like the davita.com, which can kind of share with you some meal plans, some of these things are really hearty and filling and enjoyable. And we don't want you to ever feel like you're getting restrictions from things where you're feeling sad, like you're already managing a disease that's concerning. You don't want to be like, now I can't eat all of my favorite foods. Well, you can totally mix and match some things up to include some of those health supportive nutrient dense items, and then also still feel safe in not only supporting your overall health in the kidney function, regardless if you have stages 1 through 5 or not, or if you are diagnosed, then some of these things I feel look really flavorful and could bring some excitement to your meal. So thank you, Nakama, for walking through all of that. All right, kids, listen. In these webinars, when we come to the end of this, I always ask you, what are some of your takeaways? So depending on how you're listening and receiving this information, think about your own personal health. If there's anyone in your life who is currently managing either some of those risk factors or has been diagnosed with chronic kidney disease or is going through the stages and feeling really concerned and curious and worried, maybe you can think of things that you can start doing in your own life to help put you through the goals of feeling a little bit more prepared, advocating for things. If there's stuff you're already doing and you think you're validated in it, then keep on doing it. That's fantastic. And maybe there are things that you want to stop doing, like maybe decrease a little bit of some of those excessively high sodium types of foods just to give your kidneys a bit of a break, or stop taking medicine without asking questions about long-term effects of something, like be an educated consumer in that way too, and help advocate for yourself and be prepared of whatever is going on in the future. I'm sure they're going to benefit from it. So thank you everyone for attending. We're always so grateful for anyone who registers for this. Like I said, even if you register but couldn't attend live, you're going to get a copy of this link. And we can take a minute. We have some time right now if anybody wants to add in the chat any questions, comments, or feedback, whether it's related to kidneys or not is okay. You can ask anything you want. We'll do our best to answer it. Next month in May, Thursday, May 8th, between 12 to 1 p.m. Eastern Time, our monthly webinar is going to focus on toxicities and deficiencies. You're going to find out a little bit more about what even does that mean. And, I do this for free, right? Y'all came, it was a free thing. We love giving out free stuff or low cost products that we can share. And I never really ask for anything in return other than just keep on sharing. Follow and find us on the internet world. I am Dish with Dina everywhere you can. I'm not even active on half of the platforms anymore, but I'm still on there if you need to come and find me and DM me with anything. Dishwithdina.com is the website. You can find me on there. If you are looking for a dietitian, I take a lot of insurance-based plans as well. I have a part-time private practice where I work with a variety of different people. So if you'd like to work with me on a more one-to-one basis, please feel free to reach out, check out my website, see how you can book a session with me. And then share these links. If you took away anything from it and you think somebody would be interested in it, share with them any of the other future registration things we're going to share with you too, or any of the educational or resources that we share with you. And I'm so appreciative. And also to Nahama, thank you so much for being a wonderful co-facilitator. It's so nice to be back again with a dietetic intern, and I wish everyone well. Have a good day, everybody.